Welcome, everyone. Good afternoon. I'm Maya Mannion. I am the Faculty Director of the Health Law and Policy Program here at American University Washington College of Law and Professor of Law here. Thank you so much for joining us today for this Future of Healthcare series event on climate change and health, legal, policy, and scientific perspective. We're so thrilled to welcome everyone here today on campus, and for those of you joining us on Zoom, and thank you to all of our wonderful speakers for joining us today on this very, very important topic. It's obviously on the top of our minds and on the front page of the news as we are in the midst of hurricane season. And so we're so excited to open this conversation on the links between climate change and public health. This is part of our Future of Healthcare series, which features panel discussions that examine trends, challenges, and opportunities of healthcare, and particularly the role of law and policy in shaping public health. This is a series that aims to highlight both practitioner and scholar perspectives on wide-ranging series of timely topics related to health policy. We are now in our third year in the Future of Healthcare series, and we're so pleased to have reached hundreds of attendees locally and nationally and across industry sectors. We're all also very pleased to co-host today's program with the Washington College of Law's program on environmental and energy law, also known as PEAL. PEAL strives to provide an education that is interdisciplinary and inclusive, fostering passion for the environment, cultivating legal excellence, cultural competency, and global awareness. We want to thank our terrific partners in putting on this event today. Thanks to the American University Center for Environmental Policy, which aims to improve the nation's ability to address environmental challenges through effective governance. We also want to thank the American University Center for Environment, Community, and Equity, which is committed to cultivating transdisciplinary work that focuses on the interrelations among environment, community, and equity. We also want to give special thanks to our partner, the American Health Law Association, which has partnered with us in this Future of Healthcare series from the beginning. AHLA is the nation's largest nonpartisan 501c3 educational organization devoted to legal issues in the healthcare field. This association maintains excellence in health law by educating and connecting the health law community. We're also thrilled that our very own director of the Health Law and Policy Program, Asha Scielzo, is currently serving as president of the AHLA. And last but not least, we want to thank our other partner who has been with us from the start of this series, the American Society of Law, Medicine, and Ethics, which is a nonprofit educational organization whose mission is to provide high-quality scholarship, debate, and critical thought for professionals at the intersection of law, medicine, and ethics. So with all those thank yous, I just have a few administrative notes before we begin. Please note that for those of you on Zoom, live captioning is available. This event is being recorded, and the recording will be made available on our Future of Healthcare website. So with that, I'm so pleased to introduce our Faculty Director of PEAL, Professor Bill Snape, who will kick off our chat with Professor Marcos Orellana, the UN Special Rapporteur on Toxics and Human Rights. Please join me in welcoming Professor Snape. Thank you so much.
Well, there was one last thank you, and that goes to the Health Law Program. Maya, Asha, the whole staff, this would not have been possible without you. Thank you so much for inviting us. Well, it is my pleasure to introduce Marcos Orellana, an old friend and colleague. He's an adjunct professor here, specializing in international environmental issues and human rights issues. He's an LLM graduate of the Washington College of Law, and he's an SJD graduate, which is the basically the doctorate in law at our university. He is not only the current rapporteur for toxics at the United Nations, he is a renowned expert in climate law and, frankly, all international legal fields, particularly in the environment. You can read his full bio on the website. Well, Marcos, I'll start off with what I think is a sort of easy question. and that it's a question that relates to the intersection between public health and climate change. Two things that some people wouldn't think necessarily go hand in hand. And recently, there was a decarbonization report that you and your team were a part of. And could you talk about that decarbonization report and how it has public health impacts as well?
Certainly. Well, first of all, Bill, thank you very much for that kind introduction, and my gratitude also to the Health Law and Policy Program and the Program on Environmental and Energy Law for the kind invitation to join you today. It's my pleasure to be here with you. So the United Nations Special Rapporteur role, this is a special procedure of the United Nations Human Rights Council. It's a monitoring and reporting role. And in that role, one of the tools to investigate, examine current developments, gaps, shortcomings is the preparation of thematic reports. And so special rapporteurs are independent from any government, any entity, including from the United Nations. And so that allows to have what we would say, a connection with reality. And I thought it made a lot of sense to look at the interface between decarbonization and detoxification, because humanity is being bombarded with disinformation and with a number of proposals for climate solutions without there being an assessment of what are their toxic impacts. And so I set out to look at proposed climate solutions. And so, for example, when it comes to electric mobility and the extraction of lithium and cobalt, either in conflict areas in Congo or in deep sea mining, when it comes to nickel, the recent report coming out of Indonesia in regards to human rights violations there's a lot of pressure on the natural environment, having impacts on the health of communities surrounding those extractive industries because of the extraction and communities. There's a history there. So there's an increased pressure on extraction, but now under the label of transition minerals or critical minerals, and under the narrative that, well, we are facing an existential emergency. We need these minerals in order to overcome it. Well, so disproportionate burdens from a human rights perspective, what does that mean in terms of justice? Or when somebody is sacrificed in their health or in their life because there's a broader need for society, well, human rights has the promise of the right to life, that no one gets left behind, or the promise of people enjoying the highest attainable standard of physical and mental health. So I set out to produce this report and bring to the Council, the Human Rights Council, well, first of all, the notion that decarbonization is an imperative. It's not that whether we need to decarbonize our energy matrices, this must happen, but how does it happen? So a just transition towards decarbonization needs to take into account the toxic impacts of proposed climate change solutions. And so that report brings in certain ways of doing that, such as life cycle assessments, not just calculating potential reductions in greenhouse gas emissions out of certain technologies, but what does the whole picture look like? That's one angle. And another is reinforcing environmental and health safeguards. And so, for example, a number of countries have argued that because we're in an emergency, there needs to be exemptions and waivers of environmental assessments or public participation. Well, these are critical tools for us to anticipate potential impacts and take measures. Well, mitigate is an oft-used word. I don't like it very much. I think we should move beyond that and prevent damaging impacts and harm to the environment or to human health. We could get into the specifics of that, but I think that's, in a nutshell, what this report was trying to do.
So I just want to point out what Dr. Oriana just said, we've heard this line before. I was going to interject because 50, 100 years ago, we must extract those fossil fuels. The world's growth is dependent upon these fossil fuels. Fast forward 50, 100 years, we must have that cobalt. We must have that lithium. We must have that copper or the world will come to an end. Different story, same end result, it seems to me. Marcos, not to put you on the spot too much, but could you give an example that your report, of a community or a country, say in Africa? You mentioned the Congo, but can you give a little bit more factual detail about how these extraction proposals really play out?
Sure, there are various examples that we could examine. One of them is on lithium, that as many in the room may already know, are key components in batteries, in high voltage, other voltage batteries. So the batteries, sometimes they're regarded as the bottleneck of the grid and our ability to transition because of their ability to keep power. And so electric mobility is largely dependent on lithium batteries. Not just lithium, but lithium is a key component. But there's not that much lithium around, and extracting it requires a lot of water. And for example, in the so-called lithium triangle in northern Argentina, southern Bolivia, northern Chile, well, it's a desert. The Atacama Desert is the driest desert in the world. The average rainfall is, I believe, 0.0 rainfall. And so that's pretty dry, clearly. And so for communities, indigenous peoples that have flourished in that environment, having access to groundwater, to wetlands and other sources is life, is critical to their cultural rights as well, and certainly to their health. I mean, without water, there's a range of health complications that begin to develop. And so extraction of lithium in that context requires special safeguards. But in Chile, there has been a process for elaboration of a strategy towards lithium. Some critics argue that it's more paper than anything else, but at least there's a steps towards a strategy. Not the same can be said about northern Argentina, with the current administration of President Milei trying to remove what in his ideology is seen as any obstacle for economic enterprise or economic growth, including extraction of lithium. In Bolivia, the dynamics are different, but the situation pretty much is the same, where projects do go forward without adequate safeguards, impacting on the rights of indigenous peoples for whom water, again, is life or death.
We're talking about remote areas, or your examples of remote areas in South America, semi-remote areas in Africa, but I know this is a very obvious question, but can you talk a little bit about why decarbonization actually is important in places like New Delhi or Beijing or any other populated developing? I know I'm asking an obvious question, but maybe you can draw that out a bit. What the public health harms of smog and other greenhouse gases?
Sure, no, I think it's a great question. In fact, because it highlights the co-benefit dimensions of decarbonization and a just transition, or a transition away from fossil fuels, from burning coal or oil or gas, natural gas. And the examples that you mentioned are quite apt. No, New Delhi is suffering from a severe air pollution situation. Cities in East Asia are among the most polluted in the world. And so decarbonization has all the health benefits of reducing exposure to the various air pollutants, many of them toxic, many of them carcinogenic, many of them have clear implications for the health of vast numbers of people. So these are mega cities, millions of people exposed to non-point sources and so forth. There's one example that I thought I'd mention which is another of the tools of special procedures of the Human Rights Council. As special rapporteur, I will visit countries and report on that visit to the Human Rights Council. I had the opportunity to visit South Africa last year. I reported on this visit just a couple of weeks ago in Geneva. And one of the things that struck me there in the Highveld area, so the so-called deadly air case, you may have heard of this, where South Africa's constitutional court took the right to a healthy environment that is enshrined in South Africa's constitution to order the environment ministry to conduct monitoring, establish adequate regulations and other measures. The environment ministry had exempted some of the biggest coal-fired power plants from meeting environmental and health-based standards. And so I had a conversation with the environment minister, and she said, well, you know, South Africa is one of the is facing a huge economic crisis, and it's one of the most inequitable, if not the most inequitable country in the world in terms of income distribution. If we shut down one of these plants, what does that mean for the economy? And so there's this real tension, especially in developing countries that are trying to deal with the impacts of climate change, a problem that they did not cause. Let's start with from that premise, at least in its origin. So the historical responsibility of the global north for historical emissions that have created a global emergency, the global emergency of climate change. Well, certainly some developing countries' emissions today have surpassed those of big major emitters in the global north. But historically, there's an equity dimension here that needs to be remembered and kept in mind in terms of policies. And so South Africa, trying to decarbonize, trying to move away from fossil fuels, and also because its constitution guarantees every person clean air and a healthy environment. So how does it do that? Well, that's where international cooperation and assistance also come into play. I think a good practice coming out from that visit that's documented in this report is the government, the presidency, setting up a presidential commission on just transition that has studied how to transform the energy matrix away from fossil fuels and then capture the health co-benefits that result from not burning coal and spewing out the pollutants.
We've got only a little bit more time left. And with that theme that you just presented, I know you just came back from a visit to the Ukraine, And obviously the situation there is a little different. You've got a war, you've got an aggressor, by the way, financing its whole war through fossil fuel sales. But what did you learn from your visit to the Ukraine as it relates to energy independence and health and climate? I know it was quite a trip for you, and I'm very curious what your takeaways are.
Yeah, no, thank you for that. It on my account took me about 58 hours to get back from Kyiv to Washington D.C. That's a count. But beyond that, I went to Ukraine because I'm planning on my next thematic report in 2025 to focus on military activities and toxics. And so I went there to document and study the environmental impacts of armed conflict. So questions of asbestos in the debris, the destruction of homes and buildings. And so the massive destruction and exposure of people, lead in pipes, unexploded ordnance, the destruction of the Hoverter Dam and its reservoir, releasing heavy metals that had been deposited in the sediments. So there are a number of issues that concern that visit, but the one that I perhaps highlight is on nuclear security. Because Ukraine derives most of its electricity from the operation of nuclear power plants. In the decarbonization detoxification report that we were talking about earlier, I point to nuclear as a false or misleading solution, in part because there is still no way of dealing with the spent fuels in part because of the catastrophic impacts of failure, as we've seen in Chernobyl, in the Ukraine, in Fukushima Daiichi in Japan. And what we're seeing in Ukraine now is a deliberate attack by Russian armed forces. This is systematic, this is widespread, on Ukraine's energy capabilities, energy generation, so thermal power plants, hydropower plants. The Zaporizhzhia nuclear power plant has been occupied by Russian forces. It has 6 reactors. They have put it under cold shutdown. Not only the power generation, the substations that make the grid possible, the lines, and so all of this is putting a lot of pressure on the grid. If the grid fails, the nuclear power plants that draw power from the grid for cooling the nuclear reactors, and also the ponds where spent nuclear fuel is stored, well, they lose those safety systems, and then we can have a repeat of Chernobyl or Fukushima. Now, that is a worst case scenario, but I brought this publication put out by the UN Human Rights Monitoring Mission in Ukraine, which details how the systematic and widespread attack by Russian armed forces on energy capabilities of Ukraine is leading to human rights abuses or human rights problems for the elder, for people that need to go to hospital, for kids that need to go to school if there's lack of, as there is lack of power. The winter is coming up. All of this can be regarded as a war crime because of the principle of distinction that distinguishes military objectives from civilian objectives. In fact, the International Criminal Court has issued, the Office of the Prosecutor there has issued charges and arrest warrants against high-ranking Russian officials for this, for these crimes. And so all of that certainly needs to stop. But what is beyond politics is that a massive blackout or failure of the grid and inability of the power stations to cool down has implications not only for Ukraine, certainly for the neighbors, including Russia, for the whole of Europe. And if we've never seen a single event such as a blackout producing a cascading effect on multiple reactors, but if that were to happen, it would also have global repercussions.
Do I have time for one more quick question? All right. So this is unfair. This is a whammy, Marcos. So there's no way you'll be able to answer this the way you want. But I'm not sure everyone in this audience realizes the relationship between fossil fuels and plastics. Plastics are essentially fossil fuel waste. And the fossil fuel industry, knowing this, is now banking on some plastics because maybe they won't be able to do their fossil fuels anymore. That's my quick summary. What is your take on the public health ramifications of plastics and where you see the plastics industry going and concerns that you have with what seems to be the continued proliferation of plastic?
Yeah, no, that's another great question, which could lead to a whole new
It took a long time.
In 2021, I put out a thematic report on plastics and human rights. I presented it to the UN General Assembly. And part of the strategy behind that was to push the UN Environment Assembly meeting in Nairobi to kick negotiations towards a new international treaty on plastic pollution. And that happened. And so now we're in the middle of those negotiations. There are various visions as to what should happen. Some in those negotiations see plastic pollution as a waste problem. And so we should increase waste collection capacity or capacities and recycling or other solutions. Others see this not just as a waste problem, but as a public health and chemical pollution problem because of the thousands, 10,000 by certain counts of chemicals added to plastics so that they have different functionality. So there's that. As you pointed out in your question, the fossil fuel industry is realizing that because of climate change, it won't be able to have a line of commerce in that sense. You know, fossil fuels cannot continue to be burned. And so what do we do instead? Well, the suggestion is, or the plan, to change it into petrochemicals and produce plastics. So as you pointed out, 99% of plastics are petrochemicals or fossil fuels. Less than 10% are recycled. And so recycling is a false solution. I point this out because most plastics, by design, their quality, they cannot be recycled. And industry knows this. By the way, recycling was not an idea that Greenpeace or Friends of the Earth came up with, environmental groups. It was pushed by the plastics industry in the knowledge that recycling does not work at scale in solving this problem. So this is misinformation, it's disinformation, false solutions about what should happen here in an ideal world. Production should be reduced. There should be clear targets for plastic reductions. There should be controls of chemicals of concern that go into plastics in order to cease to aggravate the toxification of our planet. Every stage of the plastic cycle should be addressed. It's not just a waste issue, it's extraction, it's the impacts on fence line communities. I've sent letters. This is another tool of the mandate to the United States, among many other countries. But in this specific example, the United States, because of what's happening in Louisiana in regards to Cancer Alley, expanding petrochemicals, the environmental racism in the zoning where petrochemical industries are zoned in predominantly African American communities, people of African descent. So we have production and then we have use, so chemicals that leach, phthalates, endocrine disrupting chemicals affecting children, affecting reproductive health, especially of women and girls. Certainly there's a waste problem as well. So all of these stages need to be tackled. And well, we'll see whether the international community is up for producing a robust international agreement that can do that.
Dr. Orellana will be very busy. I should note California sued ExxonMobil and a few other industry companies last week for deceptive practices as it relates to plastic. Please join me in thanking Professor Orellana for a great conversation.
Thank you very much.
Over to our panel. Thank you so much.
Of course. Thank you much.
As well.
Sure.
Oh, but you've got the slides in front of you. Okay, good.
That was the other question. So we won't be able to see our slides in front of us. Okay, so then are we gonna, move it? Yeah. Okay, great. We're gonna pass on this one.
All right.
I was going to ask in the elevator.
Yeah, I figured. I had a feeling. Thank you.
Okay. All right, everyone. Thank you. Thank you for that wonderful conversation, professors. We really had a really good, strong start on the many issues that we're facing here, looking at it, of course, from a global perspective, but knowing as well that there's much we can be doing right here in the US. And we're going to focus on that, I think, for the rest of our time together. So we've learned, and I think we know that climate change has been identified as potentially one of the greatest challenges for health, not only in the short term, the long-term impacts as well. So today I'm really pleased that we have a wonderful panel and some wonderful slides as well to share with you some different perspectives here that we think all need to be brought together because ultimately these challenges are interdisciplinary in nature. And so we want to look at it first from the public health law perspective, and then as well the environmental law perspective, and then tie this together and understand the impacts on communities as well as what communities can do. So that's really going to be the sort of cadence of our hour together in the next little bit here. Sorry, my name is Asha Scielzo, and I'm the director of the Health, Law, and Policy program here. So very grateful that you're all here. And we are recording this as well, and we will be putting the recording on our website for those of you who might have to sneak out a minute or two early for class or another, commitment. So let me first introduce our panelists and really have the bulk of our time be on your remarks. So to my right is Sara Hoverter, who is the director of the Center for Community Health Innovation at Georgetown Law's O'Neill Institute. Her areas of concentration are public health, food systems, and climate change policy. At CCHI, she works with community partners to address systemic factors that cause disproportionate health outcomes for long underserved racial and socioeconomic groups in the United States. Alongside our grassroots partners, CCHI co-creates innovative policy solutions that improve social determinants of health in cities and neighborhoods, using a combination of law, policy, strategy, and coalition building to bring community solutions to scale at every level. So we're so pleased, Sarah, that you're here to share your knowledge with us. Kathleen Riley here is an attorney with Earthjustice's DC regional office. Kathleen was inspired to pursue environmental and justice work after growing up in Louisiana's Cancer Alley. Kathleen primarily litigates under the Clean Air Act, with a focus on cross-state ozone pollution and on reducing pollution from chemical and petrochemical plants, including in Louisiana and Texas. And again, we're already hearing some of this in our earlier remarks. And to the far right here, we're very pleased to have Olufunmilayo and Chinekezi, who is a dynamic public health leader with a strong background in program partnership development. Most of the work she's done in recent years has centered around capacity building to advance health equity and social justice. She cares deeply about and possesses expertise on topics related to racial, ethnic minority health, particularly at the intersection of climate change, maternal health, and health literacy. Funmi currently also teaches as an undergraduate public health course and is also a certified health education specialist. Each of you will, of course, share a little bit more about your work through your remarks. And so welcome and thank you again. I'm going to make sure we have your microphones at the ready, and we're going to start here with Sara, as well as a clicker here for the slides.
Cool. Thank you.
Thank you.
Oh, that's us. Good afternoon, everybody.
Afternoon.
Oh, well, that never works. I'm Sara Hoverter. I'm a public health lawyer, and I'm excited to talk to you today about climate change and health. I get to go first. So I have two jobs today. One is to introduce the scope of the intersection of climate change, public health, and the law in less than 15 minutes. And the second is to be on time, so everybody else has enough time for theirs. So I'm going to try to move through quickly. If y'all have questions, do we want to take questions along the way or no?
Along the way, if we have a little bit of time, we'll
Okay.
try that and we'll keep going.
Okay, great.
Yeah.
So let me start at the beginning. Climate impacts. When we think about climate change, most of the country thinks about polar bears, thinks about hurricanes, thinks about drought, right? Maybe you think about air quality, all those things. Absolutely true. Less often, we think about the impacts on people's health, right? So we don't think about heat. We don't think about water sources disappearing, flooding, sea level rise and storms. Oh, these are out of order. And infectious disease, right? And so my job today is to talk about the ways in which the law intersects with those impacts domestically, and what we can do about it. So public health law here is in quotes. Because again, when we think about public health law, you may think about vaccine rules, or you may think about emergency health powers, or you may think about mask mandates these days, right? Public health law is so much broader than that. And at CCHI, we really think about public health as social determinants of health, things in the world that impact people's health that may or may not be public health. So in the intersection of that with climate change, I want to sort of put a couple of things that we're going to talk about today on a spectrum, from straight up public health to what I would say is public health, but that you might not think of quite so much. So starting with public health law and then law that impacts public health, infectious disease control, right? Squarely in public health powers, it is a public health department role. Nobody's going to argue about that. Emergency response. Well, that's coordinated, right? That's FEMA, that's state emergency management, but it's also public health and a whole bunch of other agencies together. And as we watch Milton head towards Florida, and this is probably top of mind for a lot of people. Active transportation. So that's a straight up intersection of climate change and public health, getting people out of their cars, getting them walking, biking, taking public transit has huge impacts on public health as well as on climate change. Air quality and flooding are together because I was running out of little hashtags, hash marks. Again, public health department has zero control over those things most of the time, right? But huge impacts on public health. And last, the built environment writ large. What do the streets look like? What do the buildings look like? Where are there trees? Public health department doesn't do any of that, but does it impact your daily life and your health itself? It does. Underlying all of this, of course, are two things. One, I'm talking about these as if they're distinct from one another, right? And that's the way we think about things in the law. This law controls the built environment. This law controls air quality. This law controls floodplains. People don't experience them that way. People experience them all at the same time. And so even though I'm going to talk this through from a law perspective, keep in mind that this is, coming at people every day. Second, none of the things that I'm going to talk about impact communities equally, period. Long underserved, long marginalized, usually racial minority communities in the United States have much higher rates of impacts from all of the things I'm about to talk about. And that needs to be part of our solution making. So let's start with infectious disease control, and I'm going to speed up now and just give you a taste of what these look like. That is an Aedes aegypti mosquito. It spreads dengue, it spreads malaria. It did not used to be in the United States. Now it is. It is spreading northward from Florida and the Caribbean. And as things get warmer, its range gets bigger. And so diseases that did not used to be endemic to the United States are spreading. So what do we do about that? Well, again, public health departments have infectious disease control powers. They keep track of where they are. They do training. It's all sort of squarely public health power stuff. But it's really important because especially as, diseases spread to places where they've never been before, doctors don't recognize it. People don't recognize it. And in order for us all to stay healthy and to talk about prevention, we need to know that these things are changing. Okay, next, emergency response. So extreme weather events are predicted to rise exponentially over the next, name a number of years, depending on how quickly we start reducing our emissions. Huge public health impacts that you see people being displaced, people dying in floods. One thing I want to talk about quickly is that, to paraphrase Jeff Goldblum in Jurassic Park, water finds a way. And it goes straight through that Superfund site into the neighborhood next door. And it goes straight through the trash dump into the local public school. And post-disaster, there are massive public health impacts for the communities that have historically been located next to those contaminated sites, right? Heat, I'm going to break into two pieces. The first of which is the public health response, which is, emergency, right? There is a heat wave for the next 3 days. And what are we going to do? We're going to start cooling centers. We're going to get word out. We're going to make the bus free. We're going to open homeless shelters during the daytime, which they're not usually, so that people can stay cool. Those are pretty straightforward, but honestly, when we get to built environment, we're going to come back to this. How do you keep the city cooler in the first place? Because one of the things that's going to happen is that heat waves are going to get worse, more frequent, and longer. But even when there's not a capital H, capital W heat wave, the city's going to be hotter every day. And when you can't be in an emergency response mode every day. So how do you change what the city looks like, right? To keep people cooler in the first place. Active transportation, you want people taking the bus, the subway, walking, biking. There's a whole host of transportation, frankly, spending power interventions to be done at the local and regional level. But from the top down, Federal Highway Administration has made clear that funds are able to be used to mitigate climate change, which gives at least willing jurisdictions the ability to start spending that money in different ways. Air quality and flooding, again, change what the city looks like. The more greenery and the less pavement we have, the cooler it is and the better the air quality is. We saw pictures of smog. We talked about smog earlier. We need our green space. And the way that we do that is not with public health law, but with zoning laws and street design programs and really sort of nitty-gritty, frankly, kind of boring local government law that makes a huge impact. And there are cities now that are requiring green infrastructure instead of building more, underground concrete retention, which makes a huge difference for both air quality, flooding, and frankly, community development. Last, I just want to say something about sea level rise. This blue is projected inundation zones from sea level rise. And those little green squares are water treatment plants, which, for however many million people there are that live in Manhattan now, if you aren't able to treat your sewage, we're going to have very serious public health problems very quickly. Really hard to relocate. Last but not least, the built environment has been sort of woven through all of this, but I want to highlight one or two things. One is that you can change what buildings look like. You can change building codes. You can change zoning codes. You can provide incentives for developers to put things like green roofs. You can see here the temperature difference between City Hall, which is at like 74-ish degrees and is purple, versus the county building next door, which is just flat top asphalt and is 150 degrees. It's massive, massive impact. So you can change, again, zoning and building codes to require these things, as Los Angeles has done. So I want to just close by saying one more thing about equity, which is that I'm talking about these sort of citywide or locality-wide laws, right? That seem like they apply equally everywhere. And in theory, they sort of do, right? If there's an ordinance that needs to be complied with, it applies everywhere, except that some parts of the city are getting more development than others, right? And some parts of the city are getting more trees planted than others. And so how do you think through making sure that all parts of the city, including those that have historically been underinvested in and under-resourced, get at least as much, if not more, of some of this investment and benefit? So Washington, D.C., in their last sustainability plan, did a GIS mapping of impervious surface, plus they got respiratory illness data from the Department of Health to try to figure out where the interventions were needed most in terms of an aggressive tree planting plan, cool roof plan, and cool pavement plan to try to cool off and improve those respiratory illnesses in the parts of the city that needed it most. And thinking creatively about not just one-size-fits-all policies, but targeting them to communities and people who really need it, I think is sort of the next wave of what we're seeing in climate interventions for adaptation. Thank you for having us today. I'm really excited to hear about what everyone else is doing and to hear more about, questions from you.
Well, thank you, Sarah. And we will definitely have some questions, I think, to build off this really strong foundation. You really opened some doors here for more conversation and really just more work for all of us to be doing. Let's hear now from Kathleen to understand the environmental law perspective.
Thank you. First, want to say I'm very excited to be here. I've been very excited to hear people talking about Cancer Alley and climate change and the connection between fossil fuels and petrochemical plants. Saves me some work. With that being said, I'm going to talk about myself just a little bit before I start. I grew up in Cancer Alley, Louisiana, something that's already been mentioned here. And for anyone who's not familiar, it's called that. It's the area between New Orleans and Baton Rouge in Louisiana. And it's called that because of the number of chemical and petrochemical plants sited there that then contribute to extra incidences of cancer, autoimmune disease, other disease. So it's commonly referred to as Cancer Alley, and now sometimes also Death Alley. So I grew up in an area that is affected by poor air quality as well as climate change with sea level rise and storms. I originally pursued science and then I switched over to law. I do mostly litigation. So that will be, even pre-litigation will also include commenting on EPA rules that are coming out, challenging them when they're not good enough and defending them when they are. I focus on two main areas of clean air. Oh, and I also wanted to say, yeah, I work with Earthjustice. We're a nonprofit environmental law firm, so we represent communities on the front lines, fence line communities near chemical and petrochemical plants, as well as communities on the climate front. I focus primarily on clean air. I've got two areas listed here, but I'm actually going to try and sneak in a third given recent events, so we'll see. Good note to look at the time. And as I'm sure everyone here already knows, reducing air pollution is so important to combating climate change and improving public health. We've already gotten explanations how everything is interconnected, and I will try to continue that theme through my talk. So I'm going to talk about the Clean Air Act, something called the National Emission Standards for Hazardous Air Pollutants. Actually, this is now out of order, but nonetheless, cross-state ozone pollution, smog, we've been hearing about that today as well. And I'll very briefly talk about some of Earthjustice's other work, since I myself am sort of segmented in the clean air world, because there's much more out there. So this is just going to be a little primer on the Clean Air Act to start. The takeaway is it's very big, and all of the work that I do might seem big, but no, it's a very small part of the Clean Air Act. Clean Air Act. It's got 6 different titles: air pollution prevention, moving sources, general noise pollution, and acid rain permits. But basically all the work that I do falls under that first title. And even that title itself has its own subparts. And basically all that I do falls under that first part. And then that itself has subparts. I'm only listing 2 of them here, but this gets across the environmental law world is huge. And yeah, I'll talk about 2 of them: National Ambient Air Quality Standards and National Emission Standards for Hazardous Air Pollutants. And I'll tie it back to climate change and public health. So first, we've got, in quotes, not because, well, just for acronym reasons, cross-state ozone pollution, or smog. So let's say we're in Maryland, which we're not, but let's say we are. There's a power plant. It emits nitrogen oxide that is bad for people to breathe. And it also reacts with volatile organic compounds in heat, in hot air, to create ozone, smog, which is also bad for people. But that pollution doesn't stay in Maryland. It blows across state lines to, for example, Connecticut. And there are all these other power plants in all these other states that contribute to the ozone problem in Connecticut. And it's even more complicated than that. Here's a graphic from EPA about all the interconnections. Ozone or pollution is being emitted in one state, contributing to a problem elsewhere. So the Clean Air Act has a part of it, the National Ambient Air Quality Standards. EPA is required to set standards for criteria pollutants like ozone in the air, limits on what is acceptable to breathe. The next step is states make plans to attain those. If they don't, or if they submit plans that aren't good enough, EPA has to step in and create a plan instead. And that is what happened in the case of ozone. EPA set a standard, states didn't meet it. Ultimately, EPA had to create a plan called the Good Neighbor Plan, and it's one of the big things that I've been working on. Losing my train of thought, but I'll carry on. National Emission Standards for Hazardous Air Pollutants. So these are going to be similar air standards for hazardous air pollutants from chemical and petrochemical plants. Even though these are nationally applicable regulations, they affect facilities that are primarily concentrated in Louisiana and Texas. So even though I'm up in DC, a lot of my work primarily affects communities in Louisiana and Texas. As an example, there are lots of other places. Maybe I am just excited to talk about the third thing I was going to sneak in.
Good.
Oh, and actually, yes, I do have notes here. The other thing I wanted to talk about was the Good Neighbor Rule. So the Good Neighbor Rule, the thing that came out to address this cross-state ozone pollution, and thank you for bearing with me, requires power plants and other industrial sources to reduce their nitrogen oxide pollution. They can do this by installing control technology, and that will lead to reductions in ozone pollution. This will have huge health quality benefits. EPA has estimated that it'll have $250 billion in health-related benefits, but getting to more numbers, but numbers that might be a little more meaningful, this rule, when fully implemented, is going to reduce 1.3 million asthma attacks, 470,000 missed school days, 1,000 deaths each year. Unfortunately, the litigation part of my job, this has been challenged by several states and industrial groups. And very recently, the Supreme Court has stayed the good neighbor rule pending litigation, so put it on pause while it works its way through the system. And I am happy to talk more about that if people have questions about that. But the good neighbor rule is a very important piece of public air or public health law. And then on back to the niche apps. Yeah, these are very important too. And they have both a technology aspect to it as well as a health aspect to it. You're supposed to set these standards looking at what can be done technologically as well as what's required to address health risk. And they're reviewed and revised every 8 years. I really appreciated the introduction between the connection between fossil fuels and petrochemical and chemical plants, because this is really like the next outlet for fossil fuels. And so getting ahead of it with strong standards can do a lot to, unfortunately, I might use the word mitigate, but hopefully we can do further and prevent. The last thing that I wanted to sneak in, or the third thing I wanted to sneak in, which doesn't have a slide, another area of law that I work in that falls within those same pieces of the Clean Air Act, so we're still all in the same area, is chemical disasters. And this comes up because we just saw Helene and now Milton coming through. There are areas of the country like the Western Carolinas, which haven't had to typically deal with hurricanes. And we find communities often in these situations of double disasters. A hurricane comes through, decimates the community, and then there'll be facilities, industrial facilities, petrochemical and chemical plants that have incidents, that water gets where it's not supposed to and explodes, and then you've got a disaster on top of a disaster, a technological disaster on top of a climate disaster. And there's also a portion of the Clean Air Act that's designed to address those. And we've gotten a recent rule from EPA, the Safer Communities by Chemical Accident Prevention, which is another important piece for mitigating, preventing someday, the harms from climate change to air, to the environment, and then to public health. And Earthjustice does a lot more than just me and my little air world. We're doing a lot to move beyond fossil fuels, to retire coal plants, to stop gas build out, clearing the way for clean energy, leveling the playing field, electrifying our economy. We've been doing work on electrified school buses, ports, so much more. And yeah, I love working with Earthjustice because I get to work with these communities to help create these better regulations with people on the front line, and including in Louisiana where I grew up. And we definitely prioritize. This is something that, as you were addressing, is not felt equitably and needs to be addressed as such. All right, that's my email address, and the G is on its own line.
Great, thank you so much. And now we'll hear from Funmi, so we can sort of tie this together and really see the community perspective, in particular, the
Oh, it
work
does
that
stretch
the
there.
National Academy of Medicine is doing. Yeah, let's just make sure, and the microphone
trade
is
seats
there.
if you'd like.
Okay. A little more.
Here we go.
Okay. Great.
And
Thank you.
Okay.
Okay, hopefully you all can hear me okay. I'm Fumi Chinekezi, work as a program officer with the National Academy of Medicine, as has been said. Today I'll be talking about the NAM's Grand Challenge on Climate Change, Human Health, and Equity, specifically the Climate Communities Network, which is a pillar under that umbrella program with the Grand Challenge. So I'll try to be brief, just giving a little bit of background about the National Academy of Medicine. It's one of 3 U.S. national academies. So the full name of my organization is National Academies of Sciences, Engineering, and Medicine. I'm specifically based in the NAM. The academies are private nonprofit institutions, really intended to provide objective advice to the government, but working outside of government. So oftentimes people ask, are we not a governmental organization? We are not, but we do generate a lot of research and data to inform the work of the government. NAM was founded in 1970 as the IOM, Institute of Medicine. then became the NAM, and specifically with what I'm talking about today, this grand challenge. Grand challenges were really, I would say, created to tackle really big, really complex problems in society. And I think this was before I started at the NAM, right around 2019, the Grand Challenge on Climate Change, Human Health and Equity started to come together. And it has a couple of goals and objectives. So there's 5 pillars, each mapping to a different objective. One, communicating the climate crisis as a public health and equity crisis. So that is our communications pillar. We do a lot of work on decarbonization. So a lot of my colleagues work on decarbonizing the US health sector, developing a roadmap for systems transformation. So this is really looking at all the different systems that contribute to the climate change issue. So not just healthcare, but transportation, all of the different systems. And then we have a research and innovation pillar, which is really trying to identify what research gaps still exist as we think about the climate change, human health and equity issue. And then the pillar that I work on is reducing climate-related health inequities, which really underscores the entire Grand Challenge and gets operationalized through the Climate Communities Network, which I lead. This is just a graphic showing how it all comes together. Climate Communities Network, or CCN as we call it, is intentionally sort of at the bottom, feeding into all the other pillars in the overall Grand Challenge. So the CCN was created to uplift and really center the expertise of communities that are disproportionately impacted by climate change. And we took a really data-driven approach to identifying these communities as part of our first, what we call cohort, because hopefully we'll start to bring on new cohorts. And I'll talk a little bit about our first cohort in a second. But we did a lot of GIS analyses and mapping, working very closely with the team at the University of Maryland, led by Dr. Sakobi Wilson. And we were able to identify sort of where people were located in areas that were most disproportionately impacted by climate change and other factors. And we really want to work together with those community members and leaders and partners to co-develop solutions to climate-related health inequities at the local level by addressing structural barriers, which I'll talk about in a second. So our goal is to engage frontline communities and CBOs as equal partners. And so we focus a lot on bidirectional learning. And so not just us sort of sharing, our goals and our vision, but really allowing that to be driven by the needs and priorities and strengths of our communities and our partners. We convene community leaders and partners, and there's a lot of information exchange that goes on. So really uplifting promising practices, identifying common challenges and priorities. And then we try to highlight, what's working well in these communities and how can we sort of replicate and scale up, even though we know it's not a one size fits all. What are those key principles and things that can be sort of applied across different communities? So we put out a request for applications, and we selected 18 community members or leaders. They are pictured on the slide. They're an amazing group. I really, it's been a pleasure working with them. And you'll sort of see where they fall on the map in a second. And then complementary to the members, we have our strategic partners. And so these are organizations that have a more regional, national scope. And they really work closely with ourselves as the NAM staff and members to advance the work that the members are doing at the local level. So we have we have 12 partners now. We just brought on a new strategic partner, Deloitte. And so they will be serving as our 12th strategic partner. And so really just intending to show the structure of the network. So this is where everyone is located. You'll see some probably unsurprising clusters here. And yeah, it's a great group. We have 18, but we're hoping to expand in future years. So our impact framework has 5 different focus areas. Policy, funding, research, and data are circled because they have come up the most as we've learned about our members and their priorities. And what we're really hoping to do is when we think about policy, how can we make sure that policies, not just at the federal level, but at the state and local level, are being informed by community members? And so how can we as the NAM facilitate those types of conversations outside of just requests for information that might get posted online, and communities are dealing with real life things they may not be aware? Like, how can we really create that space for that information exchange to occur? And then with research and data, really, again, with the lens towards policy, how can we collect data that is representative, context specific and actionable, that can then inform policies? And then funding has been a huge topic of interest across the members, because not only do they need funding to advance the work that they're doing on the ground, we're thinking more systemically about the policies that govern how funding is disseminated to communities and distributed, and is that process doing more harm than good? What are those barriers that could be rectified? So. Our impact statement. So this is actually a map that lives on our website. I can share the link if y'all are interested. It's an interactive map. When we were onboarding our members, we went through a photo voice methodology and really got information about their needs, priorities, what they see as their visions for the future. So you can click through each member's profile and you can see more about them, their organization, and they submitted pictures of their communities, their respective communities, and you can kind of see the pictures along with captions that they provided. So ultimately, we are really looking at transforming unjust systems into ones that equitably protect and prioritize the members' holistic well-being. I will say that this impact statement was very lengthy before, but we have really tried to embed values and principles, or we co-developed values and principles with our members and strategic partners. And part of that is always making sure that whatever we do is endorsed by them, approved by them. And so we had drafted an impact statement that was like 5 or 6 lines long. And then I realized it was just one really long run-on sentence. And they were like, it's unacceptable. Like, it needs to be shortened, it needs to be simplified. We can't communicate about what we're doing. Like, we need to be able to communicate about what we're doing in plain language to our partners, stakeholders, et cetera. So this is where we landed, probably still a little bit too wordy, but wanted to uplift that sort of process and how we came to our impact statement. So a little bit about how we think about the implications for environmental justice through the CCN, or the work that we're doing. So we know that when population vulnerabilities are overlooked, or even worse, exploited, human rights violations are inevitable. And that's really important because oftentimes we hear the words resilience and mitigation, et cetera, being used when we talk about climate change. And in one of our meetings, we heard from our members that, we're tired of having to be resilient, and that really struck home, I think, with a lot of members, and really thinking about the way we look at population vulnerabilities, human rights, and, not just things that are overlooked, but the exploitation, right? So a lot of these communities, they have experienced discrimination and historic marginalization. And so, when we think about human rights violations, it's really, really important to have that lens that the onus does not lie on communities to rectify injustices that were, imposed upon them. And so a lot of human rights are threatened in the face of climate change, as we've heard today. Disproportionate climate impacts are both driven and exacerbated by structural discrimination. And so we really look at policies and systems that place certain groups at a greater disadvantage than others. And then with environmental justice, the lens that we use, we're seeking to eradicate environmental threats to livelihood and well-being that are a result of multiple and intersecting forms of discrimination. So we've talked about how a lot of these issues intersect, and so we try to use that lens as well. And then thinking about prevention. So how can we create preventive infrastructure to protect against disproportionate impacts, but also infrastructure to support an equitable and humane response? So it's both and, right? So that is sort of the framework that we use. It's weird. I have like many more slides left, but I can.
There's more in the packet.
I have some notes that I can keep going. Yeah. But I think most of the slides we're just talking about the work that we do within the network. So each member right now is working on action plans within their community. Oh, thank you.
Have them here.
Thank you. So yes, I was spot on. So the next slide was our approach. And so member action plan. So this is local climate action that is being supported by multi-sector partners with broad reach. So those are strategic partners and other groups that we work with. We are implementing learning collaboratives and forming learning collaboratives that are really a forum to discuss critical perspectives with key players. And so when we think about policies that impact, the work that our members are able to do and their day-to-day life experiences, how can we as the NAM really put community members and policymakers, decision makers in the same room? Again, a lot of the times I might be sort of sharing on behalf of the community members, but it's like, they say it better than I do. They have the experience. They know sort of what their issues are. And so I have expertise, but it's limited. And their lived and living experience is what we really want to bring forth in terms of informing policy. So we go to a lot of spaces and we're always asking, can our members come? Like, can they actually present, on this topic or this issue? And so that leads me to the next piece of the program, which are our regional clusters. So a lot of topics have bubbled to the top, but the ones that have come up the most with our members are policy, funding, and youth engagement, actually. And so these are sort of topic-based work groups that are multi-regional. And so each cluster could have multiple regions within it. But it's really a way to align sort of policy priorities and other types of work that the members are doing across the network. And one of the things that we're looking to do with the policy cluster actually is have whether it's in-person, hybrid, virtual roundtables that ultimately become place-based, and we can actually bring local, state level, regional level policymakers to the table, whether it's a virtual meeting, like I said, or in person, whether it's a site visit, that sort of thing, but really making sure we're bridging the gap as it pertains to uplifting policy priorities that members have. I wanted to highlight our values and principles as well. I'll just read them. These were co-developed day one, so the very first meeting that we had. There were like 6 or 7. So the first one is our work is rooted in, driven by, and accountable to community, actively challenging and dismantling unjust systems, grounding communication with the assumption that all voices have value and deserve to be heard, explicitly centering voices that have historically and currently been disrespected, ignored, and silenced, honoring each other's expertise, time, and energy, fostering integrity and support, joy, and courage in our work. And then the last principle was interconnectedness. And then I think the remainder of my slides were just highlighting our members. And so we had one of our members is a physician, Jerry Abraham. He does amazing work at Kedron University. I think it's a HBCU in California, and his issues of focus are air quality, water quality, resilience, mitigation, adaptation, extreme temperatures, and mental health, which is also another large theme across the network. Max Cawley is one of our members from Durham, North Carolina. I just wanted to uplift his profile because he's based out of the Museum of Life and Science, and they actually just became one of the hubs for the NIHIS Center of Excellence on like extreme heat monitoring. And so that's been really exciting for the network. And he also focuses a lot on laws that look at cultural preservation. What else? We have Semeli, who is in El Paso, Texas. And she is a true activist to the core. Her pictures, which we can share the slides after, but her pictures show her like in the streets with signs and working with youth and get the trucks out. That's what the signs say. Another one of our members, Cindy from Sulphur, Louisiana, just hosted an environment Health and Environment Summit, and it was specifically geared towards environmental law. And so they actually were able to provide continuing education credits for lawyers, and they really wanted to bring lawyers to the community so they could hear about the issues that were happening on the ground. And Livonis, she's in Mobile, Alabama, and she is one of our members, and she focuses on some of those structural drivers that really exacerbate the climate impacts that her community experiences. So really looking at things like housing and poverty, et cetera. And I feel like, oh no, there was one more, but it's okay. I wanted to share just a couple of things that we're looking at doing in the near future, just as it pertains to really operationalizing that policy aspect of our impact framework. So the Academies has a fairly new congressional fellowship that is housed out of our Climate Crossroads initiative. And that's really an attempt to align all of the climate work that's happening across the academies, which is still a challenge. I've been there for 2 years and I'm still learning about climate work happening within the academies. It's such a huge organization, but this congressional fellowship really allows for direct engagement with congressional staffers. And so part of our impact framework was not just what can we do within the grand challenge, but how can we really embed community into the work of the academies across the entire institution. So how can we get our members some face time with some of these fellows? That's on our to-do list. The other thing is we really want to hopefully have maybe sort of closed door, open door sessions with different legislative campaign committees on both sides. And so really thinking about how we can get members, again, to have direct face time with people from their states and jurisdictions. The other thing that we are looking at, we're very expansive in our view of policy. So it's not just federal, big P policies. We're really looking at institutional policies. So medical education has been a big thing. What is being taught to providers? There are a number of our members who have expressed challenges engaging with their providers and just different, not being seen as a person and, just not really feeling like they're getting the most out of that experience and really seeing it as almost counterproductive. So, when we think about policies, let's think about medical education as well. The other thing is other key players that have a role to play in this topic, like insurers. We're trying to figure out how we can engage them as potential strategic partners. We already engage with a number of pharmaceutical companies. And so how can we bring more and more of those really key players into the conversation as we think about policy? And then those structural drivers, some of the other things that I mentioned, like poverty, because truthfully, we've heard from our members that, this is great work. They're happy to be involved, but we just got hit by a hurricane, right? And so their basic needs are being threatened. And so we've had to be very flexible and very mindful of how we can, look at policies that really affect their day-to-day lives. And then the last thing I'll say is the preservation of green spaces has also been a big part of some of our members' action plans as well. So I'll stop there. Hopefully I didn't go too much over time, but thank you all for your time and attention, and I'm happy to provide my contact and slides.
Thank you so much. And I apologize about the slides. We will make all the slides, the full deck available, which has all the contact information to everyone who's registered. So each of you has really, I think, not only demonstrated the complexity and depth of the issue, but you've also given us a glimpse into the very meaningful work you're each doing. First, thank you for that. Not only for what you're doing with us today, but for the work you and your organizations are doing. Are there any questions? We have a great group here, so I'd love to see. We just have a few more minutes, and I know folks have class soon. So if there's any questions, I'd love to bring them up. David?
What it maybe it's for the National Academy first and to work through what does success look like, and what is your timeline for success? And maybe we could start there with you.
Yeah. That's a great question. I would say, well, I'll do the easier one first, the timeline. I feel like for us, with the cohort model specifically, that wasn't fleshed out in the beginning, but then we realized that with the member action plans, they are time-bound projects. So these are 12 to 18 months that they would have to implement their projects. And these are, most of them, it's like a piece of an existing project that they have going on in their communities. And so what we're hoping to do is, as the first cohort approaches at 18 months, then we can put out another request for applications and bring on another cohort. I would say success would be supporting them through implementation of those projects. That has been a huge thing. Members don't just want to sort of talk about the work. They don't want to map it out. They want to actually be able to complete those projects, and they want our support with evaluating the impact in their communities. So being able to go through that process with each cohort, and then maybe like a mentorship sort of model. I don't want to say like train the trainer, but we're really trying to make it sustainable in that sense. And then I mentioned like things that are scalable and replicable, like how can we really maximize, take what happened here, take this success story, case study, and really apply it to other communities. And so I think that would be a huge indicator of success for us. And then also, as I mentioned, like really creating innovative processes for getting funding to communities and for the policy development process in and of itself, as it pertains to like community-informed policy. So I think those would be 2 or 3. I can't remember how many things I just mentioned, but I think that would be a huge success for us.
If we're gonna work along the same question. Yeah, I think that in my work, I've seen a lot of what I would consider successes in the last couple of years, which has been really great. We've been working with communities for many, many years on example chemical disasters, and to see the strong rule come out of the EPA, the safer communities by chemical accident prevention. That looks like success. The good neighbor rule looks like success, because what those will mean: fewer asthma attacks, fewer health incidences, more lives saved, better lives lived. And when I look at the timeline of, when I look at it in terms of public health improvements, clean air, that timeline's much nearer. It still is much slower than I'd like. It takes a lot longer than I'd like for EPA to put out a rule, and a lot longer for those rules to work themselves through the litigation process. But looking from a public health air quality angle, that is one where we can see actual benefits, like from the Good Neighbor rule when it's implemented. Every year, 1.3 million fewer asthma attacks. But of course, when it comes to climate change, the timeline will be much longer.
Yeah, I'll be quick so we can get to the next question, but I think both of your answers make sense to me. And I think the only thing I'll add is that I think it depends on who you ask. Success is, are we going to fix climate change? Well, I hope so. Am I going to fix climate change? No. And so breaking down what all of us collectively can do and what I can do, I think, into a piece where you can measure change. And I think that looks both, as Funmi put it, like I think making sure that whatever work that I do and that we do at the center is based on and informed by what the community says they need, right? And sometimes that's totally doable within the confines of the current law, and sometimes we got to change the law. And making sure that the folks that are policymakers are listening and paying attention and shifting priorities based on what the communities know that they need. I think that's success. And I think doing that place-based work in Louisville, in DC, in Milwaukee, and wherever we happen to find folks to work with, and then elevating those as examples for other people to follow. I think in the short term, that's what success looks like.
Thank you. That's a great question, and really, really helpful responses. Any more questions? I thought I saw. I'll start here and we'll go here, but we'll try to be quick because I know another class is coming in.
I was just wondering, following up on Kathleen, your map of the kind of ozone smog effects across states, starting in one state, going to another, and the good neighbor rule. Is that also a model for states that have the political will to more highly regulate certain pollution or emission effects to enforce like other restrictions on things coming into their state from states that emit or pollute more, and that like then you could start working on not only ozone but like other noxious chemicals, even climate change itself, if it actually occurs. that approach without using the federal government and its kind of ineffectiveness at times to get things done, or because the EPA and Chevron doctrine is being.
Mhm.
Ooh, big question, extensive question. First, I'll say, because the good neighbor provision, that's the part of the Clean Air Act that covers this, does put states in the first instance in the driver's seat of formulating their plans to attain and to control their pollution that drifts across state lines. They do have more of an ability. There is room for those that are leaders to be leaders, and we do see that. We see much more from some states like New York and less from other states like West Virginia. But the way it is in the Clean Air Act, I do think it's limited in its current application to criteria pollutants, but I think it is a good example of perhaps what could be done for other types of pollution that do cross lines.
Yeah, thank you.
So this is a broad question. We don't have a lot of time. So, yeah. Whatever comes to mind first, but we have a lot of students in the room. You've each teed up a lot of great work that's happening, but also a lot of really monumental and crossing problems. And so I'm wondering what advice you have for the students here who hope to engage in this work. You know, what do you hope to see from this new generation of lawyers as they come out and want to tackle these really complex problems?
So I can take that one first. So until 3 months ago, I was a clinical professor in one of Georgetown's legal clinics, and so I feel fairly equipped to answer this question. There's no wrong way to do it. Let me start there. There's huge need for litigators. There's huge need for policy lawyers. There's huge need for community organizing and community work. All of it is needed. And so think about what gets you out of bed in the morning. Not just subject matter, although that is obviously important, but what do you like to do all day? Do you like to, go in the depths of case law and West law and write briefs? Be an appellate lawyer. Do you like to talk to people and get out in the community and solve problems and listen? Be a community organizer. Do you like reading regs a whole lot? Be a policy lawyer. Think about what you want to do all day, because there's so much need and there's so much work to be done. Think about both what you can do to make an impact, but also what's going to make you happy.
I like that.
I'll add to that for a second, because also keep in mind that it's going to impact you whatever type of practice setting you're in or whatever type of law you're in, right? So you could be working in, sort of a big corporate law, and the client is thinking about decarbonizing their facility or what have you, and help, whether it's a health system, whether they are trying to implement work at the local level, as a provider. So insurance was mentioned. That we've touched on so many things that just keep in mind that wherever you might practice, there's going to be an opportunity to have an impact, and whatever your setting is, or whatever the skills you bring onto your day-to-day job. But anyway, I apologize, please.
No, those were both beautiful examples. I don't think I have anything to add to that. That's perfect.
Fumi, you want to wrap us up for the day?
Sure. I guess I can share something I've been thinking about a lot often, or recently. Thinking about a lot recently is I would encourage finding some kind of community or mentor, because that is what has kept me grounded. This work can feel heavy and sometimes very discouraging, no matter where you are, how long you've been in the field. And I think that is what I have seen keeps other people in the fight, and keeps them going. And it has been what's keeping me going, and what has kept me going. And I think, I would encourage, I'm not like a huge networker or like a huge social person. So it has really been me stepping out of my comfort zone, reaching out to people who I admire the work that they are doing and that I really want to learn from. And that can look like so many different things. Like a mentor can look like so many different things. But I think just having that sense of community and guidance is really, really important, because it also keeps you open, not just inspired, but open to the possibilities along your career path. So I just encourage that.
Thank you. What a perfect way to end this program. Please join me in thanking our terrific speakers and our panelists and organizers today. So I will join you as well in this wonderful thanks of today's event. Also to have such great participation from our community, just the commitment that you bring, passionate as students, professors, and others in the community is really valuable. We thank you for that. A couple other just quick notes. This event is being recorded. You'll get the recording, you'll get the slides. It's part of our Future of Healthcare series. And again, such a big thank you to Peel for co-sponsoring this with us. But we also have some wonderful partners, the AU Center for Environmental Policy, the AU Center for Environment, Community, and Equity, the American Health Law Association, and thank you to the CEO, David Cade, for joining us, and the American Society of Law, Medicine, and Ethics. So in addition to looking at Peel's website, the WCL Health Law website for more resources, check out these organizations. They're doing a lot of tremendous work where you can expand your knowledge and really have that impact that I think we're all trying to have. So with that, we will close things out and just thank everybody again and enjoy the rest of your day.